Hello, and welcome to our CCR-ETA 2110 evaluation webinar, which is on communication and reporting plan for evaluation findings. I'm Winnie, and I'm a member of the WSEP team, and I'll be your moderator for today's session. We're excited to have you join us for this exploration of strategies to reach diverse audiences. Let's take a moment before we begin all of this. Let's take a moment to acknowledge the land on which we gather virtually. Since our activities are shared digitally on the internet, let's take a moment to consider the legacy of colonization embedded within the technology, structures, and the ways of thinking we use every day. We are using equipment and high-speed internet not available in many indigenous communities. Even the technologies that are central to much of the art we make leave significant carbon footprints, contributing to the changing climate that disproportionately affect indigenous people worldwide. I invite you to join us in acknowledging all this, as well as our shared responsibility to make good of this time and for each of us to consider our roles in reconciliation, decolonization, and allyship. Thank you. Okay, before we get into the content of today's webinar, I have a few Zoom and shared space considerations. First, for Zoom, I ask that you please mute yourself. When you're not speaking, please change your name in Zoom to the name you want to be recognized by, and please put any questions in the chat to be answered by our speakers during the Q&A time. And please know that we will be recording the presentation today. And next, for the shared space, I ask that we respect our different opinions, experiences, and perspectives while recognizing that we're ultimately rooted in shared struggle and goals. We aim to lead with curiosity and openness today. I ask for your presence and invite you to treasure this shared time together. And finally, you know your needs best, so please take care of yourself in any way you see fit. I see a few more people have joined, so let's go back to the Spanish interpretation slide. You can locate the globe icon at the bottom of your Zoom window. Please click on language that you would like to hear. And if you're in the Spanish room, you can also select mute original audio to hear only Spanish. Okay. Let's, now that we have that sorted, let's talk about the key objectives of today's webinar. Our first objective today would be to learn how to apply culturally adapted communication and social marketing strategies effectively. We'll explore how to tailor your communication approach to diverse audiences, ensuring that your findings from your evaluation meet their specific information needs. Moving on to our second objective, we'll be focusing on differentiating and employing appropriate messengers, leaders, and communication channels to disseminate our finding. It's important to understand the unique preferences and trust factors of each audience. And by doing so, we can ensure that the results from our evaluation reach and resonate with the diverse target audiences. In terms of the agenda, we have 3 rounds of speakers. First up, we'll have Rachel McLeod and Alexandra Bonnet from John Snow Research and Training, Inc. They'll be starting off this webinar as they walk you through the general framework of dissemination strategies and lay the groundwork for this webinar in a 20-minute session. Next up, we'll have Dr. Masood Agahe, Cameron Salehi, Anna Tiger, and Ale Machuka from the United American Indian Involvement, Inc. Also, we'll be referring to them as UAII. And they will share their key CCR 2109 evaluation results and dissemination strategies in a 15-minute session. And finally, in round 3, we will have Michelle Abuna from Rhode Island Department of Public Health, who will focus on the community-based participatory research approach in program evaluation and data dissemination during a 15-minute session. And once we've heard from all of our speakers today, we will have a Q&A session for the remaining 15 minutes. As our speakers present, please use the Zoom Q&A function to post your questions. This feature will help us keep track of all the questions being asked. We'll do our best to address as many questions as we can, and we really encourage your participation, and we look forward to engaging with you. All right, so let's get the show started. I am excited to introduce my colleagues today. We have Alexandra Bonnet, MSW. Alexandra has over 12 years of expertise in HIV treatment, prevention of sexually transmitted infections, and working with diverse communities, including women, men, youth, and the LGBTQIA community. She specializes in implementing human services programs with an emphasis on the evidence-based intervention. She excels in adapting services to be culturally and linguistically responsive. Alexandra has contributed to projects assessing the needs of the LGBTQI plus community, enhancing consumer engagement, and strengthening community provider participation in HIV service planning. And our second speaker for today is Rachel McLeod, MPH-SCD. Rachel is a senior evaluation and dissemination consultant at JSI, bringing over 15 years of experience in community-based research and health communication. Currently, she co-leads JSI's dissemination strategy for the CDC Community Health Workers for COVID Response and Resilient Communities Initiative. Rachel holds a doctorate in social and behavioral sciences from Harvard University, and her work focuses on disseminating health messages to diverse audiences and training health professionals in communication principles. Her work spans various topics, including cancer prevention, chronic disease management, and maternal and child health. She has collaborated with communities in Massachusetts and internationally, leveraging digital technologies to uncover actionable insights and developing innovative strategies to address social determinants of health. Okay, and so yeah, thank you so much for joining us, and the floor is now yours.
Thank you so much, Winnie. I'll see our slide number 11, please. So before we start, and we do a deeper dive into today's topic, we would like to set the stage on communication and dissemination. And for that, I would like to go over this illustration on the next slide. So what has to happen for a message to be successful? The success of a message is contingent upon a series of interconnected steps and factors, each playing a crucial role in ensuring effective communication. So first off, to the left, we will be starting with findings gathered from the program. Complete and comprehensive research and data collection are so important, and they're the steps for developing a message that is grounded in accurate and relevant information. So this step informs the subsequent stages of the communication process. Following that one, we have the next step is to craft the message carefully, taking into account the purpose, your target audience, and desired outcomes. If you want to create a compelling message, clarity, coherence, and relevance are essential attributes for this. Once we have the message ready, we identify and use appropriate communication channels to reach the intended audience. This involves selecting platforms and mediums that align with a target demographic and the preference of their behaviors. As we go through these steps, we need to ensure that the audience is able to access the message, whether through online platforms, traditional media, or other means. The message must be easily accessible to the target audience. From this point, two things should happen to contribute to a successful message. The audience pays attention to the message, and the audience should understand it. Let's begin with capturing the audience attention. That would be to the right of this illustration. When capturing the audience attention, we also raise the probability that the audience will act upon the message. Factors such as engaging content, clear language, and relatable examples contribute to the audience's abilities to focus and understand the message. In addition to that, a successful message should motivate the audience to take action, whether it's changing behavior, adopting a new perspective, or participating in a specific initiative. The message should prompt the intent outcome that aligns with your mission and objectives. So we also need to be mindful of the various background factors that play a significant role in shaping the success of a message. Community context, political landscape, cultural norms, competing messages, misinformation, and individual preferences, beliefs, and challenges that all contribute to the complex environment in which communication occurs. Acknowledging and navigating these contextual factors is essential for tailoring messages to a specific audience and ensuring their effectiveness in diverse settings. So having said that, I am going to begin with an example. Next slide, please. So let me walk you through an example. And the scenario will be, you live and work in a diverse community that has a growing problem with food and housing insecurity and has high rates of chronic disease. COVID-19 vaccination rates were low here, but it has been increasing due to outreach by CHW. Does this sound familiar? Let's take a moment to reflect on this. Next slide, please. So the following information regarding CHW work or community health worker work in your community or in this community has been gathered by the WSEP team, and it goes as follows. So 31 participants were referred to food programs, which includes food banks, SNAP or SNAP, and WIC or WIC. 54 participants were referred to housing and shelter programs. 20 participants were referred to chronic disease self-management programs. And 350 people have received COVID-19 vaccination thanks to the support of CHWs. So the next step is now to think about how can this information help our community and our community health workers. How do we ensure that the message will reach the intended population with the right information? If something comes to your mind, feel free to chat in your thoughts. And while we do that, let's jump into the next slide. So one framework that we often use is called POST or POST, which stands for People, Objectives, Strategies, and Tools. POST was originally coined by Charlene Lee and Josh Bernoff in their book Groundswell from the Harvard Business Review Press that was published in 2011 and is a proven framework for developing a communication strategy. We found that it can also be applied to our COVID response evaluation work, and by focusing on who we are trying to reach and then what are the specific messages, for example, the number of referrals made, the benefit to the community, the impact of services, and the CHW or community health worker resilience. These specific messages are some examples, and what is our strategy, and lastly, what is the most appropriate technologies to use. So we will discuss each part of the framework as we go, but too often we focus solely on the technology. However, your goal should be to make the technology invisible practically, focusing instead on the content itself and paying more attention to that, but specifically focusing on your organization's communications, objectives, and strategies so they all align. And now let's talk a little bit through that. Next slide, please. So here we'll see a post worksheet. We will be posting this worksheet in the chat so you could work along with us if you like. If not, you can always take it and then dive into it after the webinar. But let me provide an overview of this sheet. The first step is to identify your audience and objective. That's towards the left, followed by your strategy and then technology. It is only after you have outlined your audience, objectives, and strategy that you could start to consider the appropriate communication tools to accomplish your objectives with your strategy. So if you have your worksheet up, let's play along, let's practice along, and we'll start with the next slide. That will be the P for people. So the first part of the POST framework is the people, or the P. And here we will be beginning to develop the communication plan, or your communication plan. And you should think carefully about the people that you're going to try to reach, or you're intending to reach. We discussed people first. Why? I imagine most of you know, and we already started setting the stage, but we do this because we want to build the entire strategy around the audience. To do this, we need to define who your audience is, and this could include multiple audience segments, which might have a different communication preference or who you want to reach with different messaging. Next slide, please. So while thinking about who you're trying to reach, here are some examples of audiences. You have community members with food insecurity. We have mentioned that in an earlier example in the scenario we shared. You also could have folks with chronic disease, or people who may need assistance with housing, older adults, for example, or your audience may also be organizations who work with these populations. Next slide. So as you work on identifying your different audiences, you should also need to focus on what their different needs are. For instance, community members may have questions like, what do community health workers do? And other questions could be, how can they assist me with my health and well-being? On the other hand, community organizations may have questions such as, what value do community health workers bring to my organization? And how can they contribute to well-being of our members? Their emphasis is likely on a broader organizational impact and ways community health workers can actively participate in and enhance their activities. So reorganizing and tailoring information to address these specific concerns will ensure that communication resonates effectively with diverse audiences, fostering a more meaningful and mutual beneficial exchange of information. Next slide. And as you do that, you can begin to define a specific audience for a message and consider the following factors, such as your demographics, the language preference, the literacy levels, to ensure the message aligns with the audience characteristics. Try to explore their health priorities and values to create a content that resonates on a personal level and that's relatable for folks. Identify the preferred message channels, understanding where and how they prefer to receive an information. Assess trust relationships by determining the individuals, organizations, or community associations they rely on. And last but not least, you may also want to explore the structural, contextual, and cultural considerations surrounding the message to navigate any potential sensitivities or nuances specific to your audience. And in the next slide, we have an example of a narrow audience. Here you will see you have older Latinx individuals age 65 and above, generally speaking Spanish. They maintain strong connections with their local churches and are not heavy users of social media. However, they do tend to check their church's Facebook page. So there you have their preferred media or outlet. While they might be open to receiving the COVID-19 vaccine, they harbor some reservations or concerns about it. They also may need more information on how to manage their chronic diseases. So once you create a narrow audience, we can then see how it relates to communication channels. Next slide. So when mapping out the channels for communication, you will see some methods are better suited for each community. While community events or trusted community sources are more effective with community members, policy briefs are better suited for policymakers at Congress and local level. Workshops and handouts may be better for community organizations, and journals are better suited for public health professionals. In terms of technology, you may also ask yourself, will email, Facebook, or Twitter best support your objectives and reach your audience? What about an interactive website? We want to make sure that we're considering staff capacity as well to be able to work with this, and also any additional software or program that you might need that may arise with your chosen technology. So with that, now I will pass it to Rachel, who will introduce us to the letter O of the POS or POS framework. Rachel?
Great, thank you very much. And as you can see, that was a lot of groundwork laying for your strategy. And when we walk through the worksheet and these other sections, you're really going to see how things build upon each other and how thinking through those audiences to that degree was a really helpful exercise to help plan your next steps. So once you've started to do some of that thinking, you're really going to start to think, okay, I have some audiences in mind, and maybe they're the ones we've listed. Maybe you are looking at policy levels, other organizations. You're going to have those audiences listed, but what do you actually want to communicate with them? We have that data that we showed earlier that were those findings, but what is going to be really important to each audience? And what do you want them to do with that information? And as you can already start to figure out, these objectives and what you want them to do and gain from your information are really going to differ by the type of audience and what their priorities are, and even what those actions are. And then how can you start to create smart objectives that can really help you strategize how to reach those audiences in a way that you can measure and in a way that's going to be feasible and achievable for you and your organization. Next slide, please. So in your worksheet, and I think this is helpful whenever you're trying to create a communication campaign or specific messages, in general, what are the types of concepts that you want to get across? And so as you could see, based on some of those information needs that we know that our audiences have, maybe we need to even tell them, who are CHWs? What do they do? Maybe they don't even have really a good understanding of that. And you could refer back to some of that data and say, well, CHWs can help refer you to the housing resources. They can help you find assistance for your chronic disease. So you have all this information, but you can really use it to illustrate who CHWs are and how they might be useful. And especially for community members, they might need to know, well, how do I get access to CHWs? This sounds great. I might need help. How can I engage with them? How can they help me? How can I find them? And for many audiences, I think there's going to be a lot of value in showing that data on how they can connect with community members and refer them to all of these different resources, and that they are this trusted source for COVID information, and that they can be trusted for COVID recommendations, and that they can be valuable partners. But again, the exact way you communicate this with certain audiences is going to be different. And you can, the next slide, please. And you can kind of see that when you really start to write down, okay, what do we really want audiences to do with this information? And again, we're building on what we thought about in the P step. And really, okay, so for community members, maybe you want them to start getting more engaged in seeking out community health workers for referrals. Maybe you want them to be included in the trustworthy actions in their circle of trust for trusted health information, or to get vaccinated. Versus community organizations, you might want to let them know how they can involve community health workers in their events, or get connected so they can help with referrals. So you could go through any of your audiences and kind of see same general topic, but the exact desired actions are going to differ, which means your topics and approaches and calls to action in that information will differ. Next slide, please. So this this step is really kind of linking us together with our strategy, with our next step. And I'm sure many of you are familiar with creating SMART goals and objectives. So we want them to be specific. We want them to be something that we can measure and check off that we know that we have done. I think very importantly is we want them to be achievable. As we structure this, we're trying to work within our resources and within our networks to make sure we're able to deliver on the messages that we're planning to disseminate. We need it to be relevant. And again, that relevance might differ by target audiences, and give ourselves some sort of timing. So you see, I have some examples here, and it might be you want to provide flyers to a certain list of senior centers, going back to that older population that we're trying to narrow in on in a previous example. Or maybe we want to work with a community partner and create very specific goals for how we're going to engage with them and when. Next slide, please. And as I referenced, this leads us straight into the strategy of how are you really going to engage with those audiences? And thinking back, what are those resources? How can we leverage what we have to really spread these messages and disseminate these through our different networks? And who is doing the work? And how can you really embed these messages within social organizations and within the community to make these messages last beyond just the putting out of the message one time? And how can you evaluate and have those check-ins about what's going on? Next slide, please. And so I think throughout the presentations today, you're definitely going to hear about the different types of dissemination partners and work within the community that different groups undergo. And we already know that CHWs are a source of trusted health information, and that they work to build those relationships to maintain trust with clients and with the community. And there are other dissemination partners that you can work with, other community organizations, informal and formal community leaders, and others that are well known within the community that can help us amplify these messages even further, increase the credibility so that you can take that message. Maybe it's who are CHWs and how can they help me? And they can broaden that reach and deepen that reach within communities. And we can really see this reach into the community based on a different church, or maybe it's even a bodega in a certain neighborhood, or a certain community leader that people see and is very visible, and there's a lot of trust associated with that person or organization. And this can also help if it's a message such as COVID-19, where there's the misinformation and there's hesitancy. Maybe this endorsement by your community dissemination partners help to influence those social norms and make these messages more believable and enhance that credibility of going to see a CHW and making that message even more impactful. And importantly, when we get to feedback, they can help provide messages about that audience and get that feedback from the beginning. Who are these audience members we're trying to reach? What do we know about them from that P step, and how do we best reach them? So in an example, to follow up with our earlier messages, maybe we want to engage churches as a dissemination partner. And we know that the messages then will come from a trusted source. And meeting with church leaders early and often can let us know what their ideas are for reaching their specific population. Maybe it's the elder members of a congregation. They might say, yeah, we have a post on Facebook that we know a lot of people look at. Maybe we can get a message out there. We also have opportunity in church meetings where we discuss upcoming events or important topics, and they can help you kind of craft that message and that exact strategy on what's going to be most impactful for those populations. Next slide. And finally, I think we could have a whole other webinar when we get to tools and social media and tactics, but just a note to say that, as we mentioned earlier, it's really going to depend on that audience and the types of social media and other channels that they engage with on how that message is going to look. But I think one of the important things that this slide shows is even when you're in that strategy phase and crafting that message, you can see how different sources and different channels allow for different types of messages. And so maybe you want to have text or a video or a story, and you can kind of see what your options are, and might be limited by word count. And you can kind of use these as guides to further tailor your message and also help track the engagement with that message. So social media, when it is appropriate for the dissemination audience, can be a very useful way to reach people with the right message and track it over time. Next slide. Oops, I think my little 45 got moved over. Sorry about that. But I think that overall, as you're working through this, and this was mentioned in that very first slide when we went through the whole process of successful messages, that you have to think about, it's not just putting the message out there, but it's making something that's impactful, relevant, and understandable for the end audience that you have, because they have to be able to pay attention to it, understand it, and be able to act on it for it to really be a successful message. So make your messages concise, meaningful, and useful, linking back to those priorities. Use the colors, graphics, and images that resonate with your target audience. Make sure that graphics and different photos reflect the composition of the target audience. Consider the language needs. This might be in English or Spanish. This might be, do I need to write in plain language? What kind of language is going to be understood and really accessible to that audience? If you're going to use numbers, make whole numbers and make simple metrics based on commonly understood numbers, such as percentage. Make sure, for many audiences, tell a story, link into that component. This might work for community members, you link it to their community, and it could work for politicians, although the way you'd frame that message would differ. And I think I want to end here on my part is collaborate early and often, both with the CHWs that you work with and your other community dissemination partners, because when it gets to that context and understanding, you're really going to be able to get that deep understanding and better engagement by following some of these steps and engaging others as you kind of craft these messages together. So I will end there, and then we can go on to some specific examples. Thank you.
Thank you so much, Alexandra and Rachel, for walking us through this framework. I think that lays a very strong foundation as we move on to our next set of speakers from the United American Indian Involvement Inc. So first up from UAII, we have Dr. Masood Agahi, who is a physician, a CHW workforce researcher, and a public health adjunct faculty at the California State University in Northridge. He's the founder, president, and principal investigator of the Avicenna Next Consulting and R&D Corporation, which has been conducting the UAII CCR-2109 CHW program evaluation and managing its relevant dissemination activities since the program's inception in 2021. Along with Dr. Agahi, we have Cameron Salehi, who is a program evaluation co-lead for UAII CCR-2109 CHW program and a second-year executive graduate student pursuing his Master in Public Health and Health Policy and Management at UCLA, with over 3 years of experience in community health advocacy and research and workforce development. He is passionate about empowering and supporting community health workers in meeting the complex needs of the vulnerable communities. We also have Anna Tiger joining us, who is an enrolled Navajo and a descendant of the Choctaw and Muskogee tribes, with over 7 years of community work, including a year as a community health worker. She is dedicated to uplifting Native American communities. Rooted in a legacy of advocacy and resilience, she strives to pass down cultural teachings and build a brighter future for generations to come. And we also have Ale Machuca, who is a community health outreach worker at UAII and is a first-year graduate student of Master of Public Health, with a concentration in urban health disparities at Charles R. Drew University of Medicine and Science. As an aspiring public health researcher, Ale is passionate about using her research interests in food security, chronic disease prevention, and development and preservation of urban agricultural spaces to advocate for community-centered programs and policy changes to enhance the overall well-being of medically underserved communities. And thank you so much for joining us, UAII team. Dr. Agahi, you can take the lead. You're on mute, Dr. Agahi.
I apologize. Thank you for that introduction, Winnie, and Alexandra and Rachel for a great introduction in terms of the material that we're going to be covering. As Rachel mentioned, I'm just going to go through some examples of how we've put some of the principles that we just heard about into action at UAII. Next slide, please. Just a quick overview of the CHW program, or Community Health Worker Program at UAII. It was launched in 2021 as ACDC CCR 2109 Component A grant program. And its focus has been on training CHWs, integrating them into care teams, and also get them engaged in community for COVID-19 response and health disparities mitigation, which was the essential initial objectives, really, of the program. And as we can see later, it actually has grown into even well beyond these initial objectives. The goals were to enhance CHW capacity, increase community outreach, and improve health outcomes in the American Indian and Alaska Native, or AIAN, communities in Southern California. Next slide, please. The evaluation aspect of the program, which is our part of it, has been to assess program effectiveness first and foremost, and then identify areas where the program can be improved, and we'll give some examples of those, and also validate the CHW model in general as a mechanism of improving AIAN community health outcomes. The dissemination piece of this has been very, very critical in our plan. It provides evidence-based decision-making and strategic planning internally and externally in terms of the relationships within the organization, as well as the organization's relationship with the community and other organizations. So therefore, we inform stakeholders, we guide program improvement and expansion, and transparency and accountability. We view all of this as primary functions of a good evaluation program. Next slide, please. We are very much interested in participatory evaluation process, and that's been our North Star from the beginning at UAII, to make sure that CHWs are involved in every step of the way of the evaluation, as well as the dissemination. As you can see today, they are joining us, as a matter of fact, even in this webinar presentation. They have been actively involved in the evaluation process from the beginning, in terms of data collection and interpretation of findings, and their roles in dissemination has been enhancing the relevance and credibility of the information, as that can be seen shortly in their part of the presentation. Of course, the benefits of a participatory evaluation is strengthened program ownership that is gained in this process, and as well as an improved relevance of the findings to where it actually can be put into action. And it enhances the community trust, which has been a very important issue at this particular community, as you will see in one of our CHW presentations. Next slide, please. I quickly wanted to categorize our dissemination effort to these diverse audiences in three major categories. And these are at the organizational level, at the community level, and some new directions that we really didn't plan on. And then as the evaluation information became available, we could see actually in new directions where the organization could go. And each of these three categories will be presented by one of our speakers. I'm going to briefly touch on the organizational level dissemination, which is broken down further into internal and external level of dissemination. Next slide, please. As far as the organizational level dissemination, this is internally with the CHW supervisor and the UAII leadership, all the way up to the CEO level, as well as the vice president of operations, as well as vice president of development. We have been in constant communication with these high-level leaders of the organization, and the use of and the dissemination of our findings have been very much critical in their decision making. As an example, for example, external level use of the dissemination findings is the use of the findings to support building strategic alliances with hospitals and clinics in the community and third-party payers, which is obviously very, very fundamental to the mission of the organization, to make sure that the healthcare is adequately delivered to the community, as well as the sustainability and financial well-being of the organization. Our findings were used in actual meetings with high-level leaders of these other organizations. And as I said, the evaluation team has been very much closely involved in the entire process of development of the CHW program. We've been actually been invited into some of these meetings to make sure adequate communication of the information is provided at some of these meetings with external leaders and other organizations and hospitals, CEOs, and what have you, where some of our results were tailored to be specific to that particular audience in the specific language and the type of presentations that were touched on earlier by other speakers, using different graphics and types of communicating that information. Next slide, please. As I mentioned, building trust with the community has been a very essential aspect of the program evaluation. And with this, I'm going to actually pass it on to our next speaker, one of our CHWs, Anna Tiger, who will provide a little bit more background on this issue of community trust, because it's been very, very central, especially when it comes to disseminating this information and talking to the community members. Anna, please.
Yes, thank you. So building trust within the community was one of the challenges we had to overcome because of historical distrust. I think you can change the slide. Yes. So historical distrust is a pervasive issue that has deeply affected the American Indian and Alaska Native community relationships with healthcare systems, with government institutions, and other entities. Centuries of systematic injustices and broken promises have left a lasting impact of skepticism and reluctance to engage with the systems designed to provide support and assistance, such as us, like CHWs or any programs we have connected with our organization. Next slide. Some factors that lead to this distrust are multifaceted. First and foremost, historical trauma has profoundly impacted the American Indian communities with experiences of forced relocation, assimilation efforts, and the loss of cultural identity, leaving deep scars. Broken promises and treaties by the government have only served to exacerbate feelings of betrayal and disillusionment. Cultural disparities within healthcare systems and discriminatory practices have further eroded trust, as American Indian and Alaska Native individuals often feel marginalized and disregarded in their own healthcare experiences. This longstanding distrust extends beyond healthcare to government institutions and other systems purportedly created to help, but which have often ended up doing more harm than good. So we've definitely tried to be a bridge to this type of feelings that our community might be having. Next slide. So here's how we built trust. In addressing historical distrust, cultural competency plays a vital role. For example, understanding the importance of traditional healing practices and integrating them into our services demonstrates respect for the American Indian and Alaska Native community. Additionally, our community engagement initiatives, such as hosting meetings, workshops, or doing one-on-one sessions, empowers the American Indian individuals to shape the programs and services that directly impact them. Transparency is another key aspect. By opening communications, our intentions, actions, and outcomes, we build credibility and trust within the community. And lastly, our consistent efforts to listen to community feedback and respond promptly ensure that American Indian and Alaska Native voices are heard and valued in all decision-making processes. Next slide. These are more tailored to what our CHWs have been doing. So building upon the challenges of historical distrust, these are how we overcame these barriers to rebuild the trust within the community. Professional training played a crucial role in equipping our community health workers with the skills and knowledge needed to effectively communicate and address healthcare concerns. Our training sessions covered a wide range of topics, including effective communication strategies, dispelling misinformation, and specialized health topics, with strategic focus on addressing common ailments and providing vaccine education. Our CHWs are better equipped to engage with community members and address their healthcare needs. Another way is social media engagement. It emerged as a powerful tool for peer-to-peer communication within the Native community. Our CHW is actively engaged in peer-driven platforms, sharing reliable data, information across various social media channels. By leveraging these platforms, we've been able to foster meaningful conversations and disseminated critical health information to a wider audience. Moreover, data sovereignty has been a key consideration in our approach, recognizing the importance of local insights and perspectives. We've addressed concerns around data sovereignty by sharing local numbers and insights, by empowering the community with locally relevant data. We've been able to build trust and credibility, ensuring that our efforts are informed by the needs and priorities of the American Indian community. In summary, our approach to address historical distrust has been multifaceted, encompassing professional training, strategic social media engagement, and a commitment to data sovereignty. By prioritizing these factors, we've been able to overcome barriers, rebuild some of the trust, and foster more meaningful engagement with the American Indian community. Thank you. It will be going to Ale now.
Hi, good morning. Thank you so much, Anna. Yeah, so here we're looking at, we're going to be looking at 2 examples of specific programs that are currently under evaluation. So the first one is looking at our community heart workshops. And so just a brief program overview and impact. These are health workshops that integrate cultural education with art activities. And so some of the mediums that we use for disseminating health literacy within these workshops include health presentations during these art sessions with simplified, some of the mediums also include simplified health concept videos and then also finally culturally tailored recommendations. Next slide, please. Okay, so for this slide, we can observe on this screen that we have some examples of how we collect feedback from our program participants. And so some of these include, as we can see, Instagram posts, email feedback, as well as Microsoft Forms. Next slide, please. Okay, so as we can see here, we have some of our, specifically our approach and our dissemination strategies. So our data collection approach, what it does is we try to be as honest and critically engaged as possible. And this is to account for the historical mistrust of medical and scientific communities. And so some of our dissemination strategies also include creating, as we mentioned, creating tailored presentations with key findings prior to the beginning of our workshops. And these can be in video formats or PowerPoint presentations. And our aim is to keep the messaging to a minimum, highlight the impact of their feedback on the program, and finally promote transparency and directly address their concerns regarding data collection. So we can move on to slide, please. Okay, so here we are moving on to another one of our programs that is also currently under evaluation, and this is our grocery giveaway initiative. And this program, we can move on to the next slide, please. So, okay, so this program is really important to us because as we can see here, data provided by the Center on Budget and Policy Priorities, around 23% of Native, American Indian and Alaska Natives were food insecure in 2022. So that's something that we consider in the grander scheme of what we're doing here. So next slide, please. Okay, so here we're going to just look at a very brief overview of our program. So our mission is to improve access to healthy food and nutrition literacy for our clients. We partner specifically with, specifically for our produce, we partner with a South LA nonprofit, which allows us to secure a consistent supply of produce for our community. Next slide, please. Okay, so as we mentioned, this program is under evaluation, and we recently collected preliminary data from our clients. And so this is just some of the methods that we're utilizing to disseminate these results. So we broke it down internally and externally. So internally, we share findings with decision makers through meeting briefs, internal decision makers through meeting briefs and customized presentations that typically address client needs, obstacles to meeting their needs, as well as any recommendations. And we also train our community health outreach workers, usually during biweekly meetings that we have. And these can be in presentation formats, as well as through email newsletters. And we aim to enhance our understanding of the impact that we have when collecting data from our clients. And then to also get CHWs involved in the strategic planning portion. And now externally, we focus on our clients. So we tailor the results to our clients by utilizing digital platforms, not digital platforms, by creating video messaging presentations that are short, concise, and our aim here is to address and maintain the trust that we have created with them by ensuring them that their data or that their feedback is actually being implemented to make a change and meet their needs as effectively as we can. And so finally, we also utilize this data with collaborative organizations. So we usually tailor summaries for our clients where we usually utilize digital meetings, usually digital platforms for meetings. And here we also tend to provide them periodic updates. So these can be anywhere from like brief summaries. And so for one example of this was our collaboration with, is our collaboration with a local food bank. And so as we can see here, this is some of the data that we share with them in driving the conversations as to what our clients need and what their role would be in supporting our program and meeting our clients' needs. So overall, our dissemination strategies typically ensure that our stakeholders are well informed and engaged in driving positive outcomes for our clients. And I think that's the final slide.
Okay, great. Thank you. Well, thank you to Dr. Gai, Anna, and Ale for discussing some of the dissemination strategies within our CCR-2109 program. I'd like to now, for our last segment, just quickly take a brief moment to also touch on how we have applied some of our evaluation findings and disseminated information on a bit more of a broader scale to enhance both the capacity and the engagement of our CHWs. So through the CCR-2109 evaluation at UAII, we used our evaluation results and our findings to show us where some of our strengths are with our program, and we've applied that knowledge of those strengths to expand further and pursue opportunities both with and for our CHWs beyond the 2109 program. And one of the primary strengths that we realized through our 2109 evaluation process has been the value of involving CHWs in that process itself. And as we discussed earlier, our CHWs have been actively involved in the evaluation process by supporting such activities as data collection and interpretation of findings and even dissemination efforts. And this level of engagement is what has helped make our evaluation results more robust thus far. And as we involve CHWs in these activities, like data collection and interpretations, we realize that these can be significantly applied in other areas as well, whether that's such areas as policymaking efforts all the way to climate resilience strategies. And here we've listed just some of those application areas where our CHWs have been involved. For example, the California CHW Committee of Practice and the subsequent California Association of CHWs, where some members of our UAII CHW team have been involved in workforce development efforts and even providing insights to support policymaking efforts in California, such as the state plan amendment drafting process that took place in 2022 to make CHW services Medicaid reimbursable for the first time in California. That was just one example of their supportive and advisory role that they played in that process. but perhaps even more significantly has been their involvement in AI/AN climate resilience strategies through the Greener Grassroots Initiative, which is essentially an initiative that we began here at UAII last year that focuses on training our CHWs to specifically address the health effects of climate change and environmental changes in urban American Indian and Alaska Native communities in Southern California. And also, this has led to some other opportunities like grant proposals and even conference attendances, such as the Network for Public Health Law conference, which we actually attended with members of our CHW team, including Anna, last October in Minneapolis. Next slide, please. And just quickly, through all of these external non-2109 ventures, it's important to know that knowing our audience has been a key factor. For example, with our conference attendance, as I mentioned last October at the Network for Public Health Law, we made sure to tailor our messaging to a more academic audience through a formal poster presentation that we presented in person there at the conference. And we recognize that something like a poster would be the best way to discuss the findings and the impacts of the Greener Grassroots Initiative focused on climate resilience in a manner that is best suited to connecting with the general academic audience and even policymakers that were present at the conference. And here is just a small screenshot of that poster that we presented with our CHW team. But the key takeaway is that our involvement in these external CHW capacity building opportunities and our deliberate approach to dissemination based on knowing our audience has allowed us to develop, other opportunities and avenues for growth, like academic collaborations, like those with members of the Network for Public Health Law, and even expanding the CHW scope of practice by going into new territories like climate resilience and even policymaking efforts. And next slide, please. And with that, I just hope that, through our discussion today, it has shed some light on some potentially helpful and insightful dissemination strategies that you all can take away as you interact with diverse audiences. And we thank you for your time and encourage you to reach out to any of our members of our team here, as mentioned on the screen. And we look forward to taking any questions later on in this session. Thank you so much.
Thank you so much. That was an absolutely wonderful presentation and a very concrete way of showing how things can be done. And so, yeah. And so thank you, UAII team. And as for the next speaker, we have Michelle Abuna. Michelle is a SEM, is a mixed methods researcher with a diverse background in program evaluation, clinical research, epidemiology, and sexual and reproductive health. Michelle holds a Master of Science in Global Public Health degree from the Brown University School of Public Health, and she is the lead evaluator of the CCR initiative at the Rhode Island Department of Health. Previously, she was a clinical research intern at the Yale Center for Clinical Investigation and working to support the Cultural Ambassadors Program, a community initiative that increases minority participation in clinical research by directly connecting clinical investigators to community organizations and resources. In her previous and current role, Michelle utilizes combined methods, including qualitative and quantitative research design and community engaged methods. All right, thank you so much for joining us, Michelle. Please, the floor is yours.
Thank you for having me. I'm just waiting for my presentation slides to go up and I'll begin.
It would be like an eagle's nest when you just see certain people walking through, and every now and then somebody walks by with something.
Thank you. So as Winnie stated, my name is Michelle Abuna, and I am the lead evaluator of the CCR-2109 grant in the state of Rhode Island. So today I will be talking about the role of community-based participatory research and RIDO's work. For this presentation, I will be focusing primarily on participatory coding and analysis and how it informs data dissemination. Before I go into it, I will be sharing how the evaluation team's background with CBPR influenced the approaches used on our evaluation on this project. Next slide, please. So I have experience in CBPR from my time at the Yale Center for Clinical Investigation, also known as YCCI. YCCI has an initiative called the Cultural Ambassadors Program. This program is a community initiative that increases minority participation in clinical research by directly connecting clinical investigators to community organizations and resources. The Cultural Ambassadors Program educates and engages trusted leaders of New Haven's African American and Latino populations who represent their communities by involving them in study design, the creation and translation of culturally sensitive recruitment materials, direct subject recruitment, and dissemination of results. I have been able to incorporate two central tenets of the Cultural Ambassadors Program in our work, specifically having community representation involved in study design and dissemination, and highlighting community voices, in our case, community health workers and people with lived experiences, who I'll be referring to as CHWs and PLEs for the remainder of the presentation. But we have been incorporating the CHW and PLE voice in evaluation and program implementation. I also had an evaluation partner who unfortunately left the project at the end of the second year, but I would like to highlight their experience with CBPR as well. My evaluation partner's experience with CBPR came from a project called the Noise Project with the Cornell Lab of Ornithology that looked to create a framework for more equitable CBPR collaborations of community partners and dominant culture institutions. The co-creation of this framework and all the parts of the project were led by community partners who decided on critical race theory and grounded research as frameworks for the project. Through this work, they had experienced the co-creation of community coding analysis process, which they brought to our work at RIDO. Two concepts in specific have been valuable to transfer to our work. So the first is keeping an eye out for power dynamics. This includes understanding who's in the room, what positionality they hold, and how they can be inequitably impacted by our practices and choices. This also includes understanding who on the team is more at stake when it comes to losing access to resources, funding, and opportunities, as well as understanding what equitable authorship looks like when we're collaborating. The second value is an emphasis on actionable community impact through dissemination that centers community priorities. Next slide, please. So why CBPR? Collaborative research builds trust between researchers and the community, as the community is more likely to trust and accept the information if the community voice is centered. CBPR allows for the development of communication strategies that align with the community's preferences, ensuring that the information is received and understood. Additionally, CBPR emphasizes translating research findings into actionable knowledge, making data dissemination more practical and applicable to the community's context. In our case, CHWs and people with lived experiences. Researchers and community members learn from each other, contributing to a more informed and respectful approach to data dissemination that considers both perspectives. Next slide, please. As mentioned earlier, our previous work in CBPR really helped the evaluation team transfer participatory values in our current work. Additionally, the fact that we would be working closely with the narratives and experiences of community health workers and people with lived experiences made it evident that participatory practices would benefit everyone involved by offering several opportunities. For starters, it is an opportunity to center equity, collaboration, and different ways of knowing. It also adds valuable perspective to our data collection and analysis, thus giving us deeper insights into our data. It creates an opportunity for capacity building for CHWs and PLEs involved, hopefully providing skills and knowledge that transfer over into their current and future roles. This process is also capacity building for us as evaluators as we continue to grow our skills in collaborative and inclusive practices. It can help us overall build strong relationships, bridging the community and the Department of Health in a new way, hopefully fostering more trust. Next slide, please. So moving on to our participatory coding analysis process. Year 1 and 2 of the grant culminated in focus groups with CHWs, PLEs, and organization leaders. So Annette Salazar, who's the lead CHW for component C of the grant, and Vanessa Vieira, who's the West Elmwood Health Equity Zone person with lived experience, coded and analyzed focus group data alongside the RIDO evaluation team. During virtual collaborative coding sessions, which spanned 2 weeks, Annette worked alongside the evaluation team in coding and analysis alongside the lead evaluator and the evaluation partner. Through this process, Evaluators were able to deepen their understanding of the data through SWANET's knowledge of the CHW workforce and culture. Coding alongside an experienced community health workers gave the evaluation team deeper insight and context into participant responses. Similarly, coding sessions spanning 2 weeks with personal lived experience, Vanessa also gave us deeper insight and context into participant responses. Vanessa used her experience as a PLE and community member to speak on challenges and suggestions brought forward by focus group participants. These contributions helped the evaluation team determine if the themes arising from the focus groups were specific to focus participants or if they were rooted in larger trends surrounding the PLE experience within organizations. These suggestions will be valuable as Road to Equity teams look to assess the value, benefits, and challenges of engaging and integrating people with lived experience at the organizational and community level. I want to highlight a quote from Vanessa on her experience and perspective of community coding. I apologize. I believe that when my presentation was integrated, the format was a bit warped. So the quote is cut off. But Vanessa stated that there's a lot of value in community coding. I feel as if data coding keeps the focus where it needs to be. Also, it assists by finding the relevant data for community initiatives and to keep our programs running. These focus groups and coding of the data help to inform all parties of how they are doing and what is working or not working. Next slide, please. So collaborative coding with SWANET and Vanessa entailed 2 forms of preparation, prepping the data and prepping the relationship. And this is really important. So prepping our data involved anonymizing all transcripts and reorganizing the data. Almost as important or even more important is prepping the relationship, which involved speaking to the CHW and PLE and their supervisors to make sure their involvement was respectful of their other roles and responsibilities as they're really busy. We also met with SWANET and Vanessa before coding to discuss the process. So we wanted to hear how they felt about being involved and where they felt they needed support, and provided them with any necessary information that would increase their comfort level with the coding analysis process. For this process, we use Atlas TI, so we also had to ensure that we went over that program with SWANET and Vanessa. Next slide, please. We held multiple coding sessions spanning over 2 weeks with each participant. The lead CHW and PLE were equally involved in all steps of coding and analysis, including creation of codes, subcodes, coding of data, identification of themes within the data. SWANET and Vanessa were active in categorizing and grouping data into different codes and defining the contents of the codes. These codes represented patterns in participant responses that allowed us to generate different themes. The themes we identified with the PLE and CHW represented CHW's and PLE's responses and provided insight into experiences with networking sessions, trainings, deployment to organizations, and engagement within communities. Next slide, please. Participatory coding approach to coding analysis gave us very rich insights. We feel that our understanding of the data deepened with SWANET and Vanessa's insight and perspective. As we coded, SWANET was able to add valuable knowledge that contextualized responses through our general scope and understanding of training, working, and supervising as a community health worker. We were also able to record SWANET and Vanessa's suggestions and solutions parallel to the coding process. This means that when we finished coding, we also had a collection of comments that offered CHW and PLE-centered solutions to some of the challenges and barriers brought forward in our data. And directly from SWANET, a lot of benefits in her involvement in participatory coding. So after our process, we spoke with SWANET on her experience and wondered if she also felt impacted through the experience. She shared with us that it was a great opportunity to become more comfortable in a new research skill, and that she also enjoyed engaging with the analytical thinking that this kind of process required. One thing she brought up that really struck me was that she was super used to being on the receiving end of the focus groups for community health workers and contributing her responses, and that she found it so neat to be on the other side. So to quote SWANET, to be able to see what happens with that data, this detail seems so important to me because there's so much power in that transparency. And this process can take away that daunting feeling that daunting feeling, that detached feeling of what's happening with my data, with my stories, with my experiences. Next slide, please. So in addition to focus group reports and presentations, we are experimenting with utilizing YouTube to disseminate our results. YouTube serves an accessible platform, ensuring that a wide audience can easily access and engage with our evaluation results. So beyond accessibility, videos offer a visually appealing and dynamic way to present information, enhancing viewer interest and retention. We plan to integrate visuals, graphics, charts, and narration in our videos. Furthermore, YouTube is very user-friendly, and these features facilitate sharing through diverse channels, including social media, email, and websites. We plan to make our evaluation videos time-efficient with a 5-minute duration, allowing us to officially communicate key evaluation findings without losing our audience. Next slide, please. Furthermore, as part of our work towards community impact, Swanette and Vanessa use their experiences as community health workers and people with lived experiences to offer suggestions to challenges brought forward by focus group participants. These suggestions are valuable as the project looks to implement better training and engagement of CHWs at the organizational, community, and state level. We share results from our focus groups with the Community Health Worker Association of Rhode Island, also known as CHWARI. CHWARI is responsible for training development, implementation, and evaluation. We have already begun incorporating themes from focus group results as part of our participation in the CHW strategy team. In Rhode Island, the CHW strategy team acts as a liaison between CHWs, CHW employers, and policymakers to champion aligned varying goals and interests through different work groups. I have been involved in the advocacy and sustainability work groups. So I've been able to share these results with other work group members. Lastly, Swanette also provided resources for CHWs that are shared through multiple avenues, including the strategy team, the CHWARI website, and newsletter, as well as RIDO's newsletter and monthly CHW gatherings. Focus group results are also presented to stakeholders, including CHWARI, as I mentioned, the strategy team, and RIPEN, which employs the largest number of CHWs within the state of Rhode Island. We share results with stakeholders to ensure that they're involved and updated on the CHW initiative and evaluation results, and to ensure that at these leadership tables, the CHW voice is always centered, as well as the PLE voice. Thank you. Questions?
Thank you so much, Michelle, for walking through your very integrated process. And it was extremely insightful. And we really appreciate the effort that you and your team has put into developing this process. So
thank you so much. Thanks for having me.
Thank you to all our speakers for those insightful presentations. And if you're up for it, we'll now move on to the Q&A session. If anybody has any questions, you can post them in the... So I have a few questions that I have that has been posed. This is for either Rhode Island or Michelle or UAII. So Rachel stressed collaborate early and often in her presentation. Did any of you include policy decision makers early on as a part of your evaluation planning team? And if so, has this been helpful in communicating findings and answering the questions they may have as they consider measures to build sustainability?
I can address that first. We actually, before getting involved in the CHW program at UAII, we were already active on the advocacy side of things and with policymakers at the state of California through the California CHW cooperative that was in its early stages of gaining momentum, because the whole concept of community health workers as a workforce in California has actually been lagging behind other states in the country. And we have been involved in this phase of rapid growth in the workforce as a result of the COVID-19 pandemic, when a lot of interest was focused on developing the workforce. And so prior to the CHW program getting started, we were already in advocacy discussions with policymakers at the state level as the planning was being was underway to create a state planning amendment to be submitted to the Centers for Medicare and Medicaid Services to be able to include CHW services as part of Medicaid, which we call Medi-Cal in California, benefits. So yes, so by default almost, we already had a lot of influence from the perspective of policymakers at the state level because we were involved in those stakeholder discussions regarding getting CHW benefits covered as a Medi-Cal benefit. And later on, and it's still ongoing, the certification process and the requirement for CHW certification in California, which is still not finalized. The Medi-Cal benefits of CHWs went into effect a couple of years ago, but we still are working on certification process. And we are very much closely involved with the agency that's responsible for that process, which we call HCI here in California. So yes, it's been actually a very critical aspect of our work. And as the CHW program at UAII got underway, almost naturally, we got the CHWs involved in this process of advocacy and policymaking from the very beginning. They started participating in the community of practice meetings that are statewide, and a couple of them were actually involved in co-chairing special interest groups on various topics. So yes, the short answer is yes.
And we have another question for the UAII team, so you're not off the hook yet. This is from Christina El-Saidi. Could you please share some of the data collection strategies and tools that consider community historical mistrust with systems?
I think I'll let Anna take that question since she provided that portion of our presentation. Anna, are you still with us?
Yeah, sorry. The question shares data collection strategies and tools. So, I mean, a lot of us CHWs are already within the community. We're mostly Native American ourselves. So I think our strategy was already built. We have connections with the communities, or we know leaders within the communities that we can talk to. And then from there, we build their trust just by continuing to communicate with them and being transparent with what programs we're doing or what we're developing. I think really keeping them like in the loop helped us with mistrust and telling them like, you know, actually we really are doing this for you. I don't know if I understood the question correctly.
I think I can add a little bit to that since we've also been involved in evaluating some of these strategies. I think small group meetings that are regularly being held at UAII headquarters through these workshops, a couple of which were presented by Ale, as well as the regular appearance of the UAII team at powwows that bring together the community members in a very culturally familiar setting. And during these powwow gatherings, UAII has been regularly present, either have a kiosk or table present there. And increasingly, people have been very responsive and curious, and slowly coming to the table and the kiosk, asking questions. And it's a slow process, but it's definitely been progressive process of engaging the community. So I think the most important thing is being out there and being seen and being very receptive and humble and ready to basically receive information as much as giving it. So I don't know if you wanted to further elaborate on that. I just wanted to kind of add these cultural events, I think, have been very, very important.
I can also add a little bit to that as well. So I know Anna and I have these conversations a lot about some of the concerns that our community has brought up regarding data collection. And so I know we were discussing this recently, Anna and I, about how our community tends to experience survey fatigue. And so we're very conscious of this. We're very conscious of how, historically speaking, relationships with Native American communities or between Native American communities and scientific and medical entities have usually been relationships of data extraction. And so we're aware of this. And so what we usually do is we try to be as creative as possible in collecting this data. But one of our big focuses as well is ensuring our clients that we're not just going to take the data and leave. You know, the data is being used to advocate for their needs and their preferences. And so we just emphasize that the value of their feedback a lot throughout this process. And we're very conscious about that, once again, because it's a way for us to address this history of historical mistrust with scientific and medical entities.
Thank you so much, UAI team. And we have one more question, and that's for Michelle. Like, could you describe any ways the rich lessons you learned during community outreach on COVID-19 help as you communicate evaluation findings?
I'm sorry, do you mind copying and pasting that question in the chat?
Yeah,
Thank you. I will just start off by saying that, you know, I think that I don't have that experience in the community. You know, I'm here at the Department of Health, so it was very important for me to center the community voice. Community health workers are the ones that are working within the community. People lived experiences. They're from the communities that we are primarily focusing on. So, you know, I was like, how do I do that? Because we feel like the process is usually very extractive, and we've heard that from CHWs and PLEs themselves. It's like we do all these surveys, and Ali just mentioned that survey fatigue. We do all these surveys, interviews, focus groups. We don't really know how the data is processed, what the sense making is like. I think the biggest lesson that we were able to learn from that is how important it is to get that extra perspective. Because I remember like coding with Swedet and Vanessa and being like, oh, I didn't think of that. Or, you know, I don't have experience with that. Because they're the ones that are in the community, and Swedet is a lead CHW as well. So it's important to note that not only is she a community health worker, but she's kind of a resource and a supervisor for all the other CHWs that are on the project. So she's not only speaking for herself, but for the other community health workers on the project as well. So I think there's a lot of lessons learned about the impact that CHWs have, the roles that they play in the community, just how they build community trust, outside of just like, you know, hey, I'm from the community. Like CHWs are actively, I remember Swanet telling me that, you know, I don't work like a standard 9 to 5. I'm working, you know, in the evenings, I'm making calls. On the weekends, I'm picking up diapers, I'm picking up medication. Those are not things that I really am able to understand as somebody that is working that standard 9 to 5 as an evaluator in the office. And I think these are very important lessons that I don't think I would have been able to get if it wasn't for their participation. I think I also want to point out as well that working with CHW and PLEs, sometimes, you know, there's that one PLE or one CHW that has one response and it's an outlier. We're able to get that extra context from CHWs and PLEs being involved in the coding process. You know, is this a one-off response, or is this a trend that you have noticed as a PLE or as a CHW in the field? It really gives you that extra context that a 2-hour focus group, you know, doesn't give you. I hope that answers the question.
Thank you so much to all our speakers today. And as we wrap up our question answer session, we kindly ask you that you take a couple of minutes to answer all the people attending the webinar, our Zoom poll, for feedback and assessment of the webinar. The question should pop up on your screen now. And please take a minute to submit all your answers. I'll leave it open for now. In the meantime, as you fill out the answers, we have a few announcements. As you know, there's a CHW Sustainability Summit happening from April 16th to 18th in Spokane, Washington. And the recordings of the keynote presentations of the Sustainability Summit will be shared on AMP. And next up, in terms of, next slide, please. In terms of additional technical assistance, if after the webinar, if you need any assistance on this topic or any other evaluation topic, please submit TA requests on AMP. We also have all our webinars available on WSEP and ASU YouTube channels, as well as AMP, and we'll also soon distribute our flyers spotlighting additional evaluation resources. And again, if you have any questions, please don't hesitate to reach out to us for technical assistance. Right. Thank you, everybody.